Hi, Dr. Yass here. In this video, we're going to discuss the two primary causes of gluteal region pain, butt pain. And before we begin in discussing the causes, you actually have to be able to understand where the lower back ends and the gluteal region begins. And to do that, we're just going to kind of look at this picture very briefly. These are your pelvic rims right here. So if you were to put your hands on what you would be calling your hips, it's really the top of your pelvic rims. And if you notice, when you come across here, it actually is in line with L4, L5. So it really, the pelvic rims run pretty much right along the bottom of the lumbar spine. There's one more, L5S1, that's slightly below it, but basically that runs across it. And if you notice, you have muscle that attaches right from the rim. The gluteus maximus, the gluteus medius, they run directly from the gluteal rim, from the pelvic rim. So if we want to talk where the gluteal area begins, the gluteal region, then we have to say that it begins at the pelvic rim. Again, that area where you would put your hands on the top of your pelvic bones and you can feel it goes in. What you're feeling when it goes in is actually the lumbar region. So any pain that you might have, if you put your hands on the gluteal rim, on the pelvic rim, and your thumbs run across, anything that's below that is in the gluteal region. Therefore, any structural abnormality identified in the lumbar region could never cause it. This is a critical thing to understand. Whether it's a herniated disc, stenosis, pinched nerve, arthritis, anytime someone tries to identify a lumbar region structural abnormality creating gluteal region pain, it's a fallacy. It's a lie, could never happen. So be able to identify where the gluteal region begins and recognize that it is independent of the lumbar region, and any structural abnormality in the lumbar region could never create pain in the gluteal region. This is something you have to understand, and it doesn't matter how many doctors or surgeons or anybody tries to tell you different. These are the facts. This is absolute. Okay? So we're going to put our hands on our pelvic rim. Any pain below that, that's in the gluteal region. The two muscles that most can strain and elicit pain in the gluteal region are the piriformis and the hamstring. And I just had a fellow, let me just make sure you understand the way the medical system fails and how it could leave people in pain for years. This gentleman mentioned to me that he had gluteal region pain. And he had been to multiple therapists. They were all talking about the piriformis, and it failed. They couldn't resolve it, so they went back and convinced him that he needed to get an MRI, and he found a L5S1 herniation in the lumbar region and ended up getting a microdiscectomy, back surgery for this herniated disc. And of course, it did nothing. And in fact, shortly thereafter, his pain was increasing as he tried to do more and more activity. So he was unable through the medical system to be able to properly diagnose the cause of the pain, which ultimately led to unending treatments, whether it was physical therapy, chiropractor, the surgery, all of it, the epidural nerve blocks, it all failed. So he finally got the opportunity to work with me. And the very first thing I said to him was, can you point to where your pain is? And without any hesitation, he pointed right here. Right here. And what you'd have to know is that this is where the hamstring attaches. The posterior thigh muscle at the top attaches to the ischial tuberosity right here. This point right here. So within under 10 seconds of me asking this guy where his pain was, we were able to determine that the reason why years of pain persisted, why he's been forced to stop doing the things he loves, why the medical system completely failed him, was because he had a hamstring strain this entire time. And yet they were talking about his lumbar spine, the piriformis muscle. And I asked him, are you telling me that you never pointed to where your pain is with anybody you've ever treated, who's ever treated you? And he said, I've shown everybody this. And it's stunning. This is a stunning testament to the lack of understanding that the entire medical establishment has. That when he pointed directly to the attachment to the hamstring, that nobody recognized that and then had to recognize why that hamstring would have strained. It's disgraceful. So we were able to do some exercises through the Yass method, understanding how to do isolated strengthening. I had to make sure whether it was shortened or lengthened to know whether I needed to strengthen the opposing muscle or that particular muscle. You have to understand something about the length of muscle and whether you need to strengthen a muscle or stretch it before strengthening it to get it back to its optimal length. This is all part of the Yass method understanding. It's not part of any curriculum in any medical establishment. This is something I developed over years after getting my physical therapy credential, which basically has no value in what I do. This is a completely separate understanding. So he felt better after that first treatment, and I think he'll be able to resolve his symptoms and be able to return to all the activity. He wants to walk, he wants to hike, he wants to jog, all the things he loves to. Now that he understands the cause of the symptom, it can now be addressed appropriately. So going back to the concept, there are two primary muscles that can create pain in the gluteal region. There is the piriformis, but the piriformis attaches to the sacral spine all the way up here, right next to this is the gluteus medius muscle. So it attaches right next to it to the sacral spine and then runs down to the hip joint. So the pain for the piriformis is going to be very high in the gluteal region, very close to the spine. This is where it attaches. If you come straight down, all the way down into the middle buttock, that's where you're going to find the ischial tuberosity and the point at which the hamstring attaches. So if you're having pain in the gluteal region, you're going to kind of have to assume it's one of these two causes. It's either a strained piriformis or a strained hamstring. The difference is where you're experiencing your pain. Either it's in the upper section, close to the sacral spine, or it's in the lower section, right in the center of the butt where you could feel you sit on a bone. That's the ischial tuberosity, that's the hamstring, okay? So the two primary causes of pain in the gluteal region are a piriformis strain and a hamstring strain. The other common diagnosis given by the medical establishment is SI joint dysfunction, complete bull. Makes no sense. As long as you can move your legs, bringing your knee to your chest and putting it down and opening and closing your legs, there is no reason, as long as that's the same on the affected side as the unaffected side, there's no reason to think there's anything structurally wrong with the SI joint. Therefore, there would be no reason to actually believe that that's eliciting your pain. Going back here again, you can see this is the SI joint right here, and what sits right next to it? The piriformis muscle. So without an ability to identify the piriformis muscle, which is not something commonly identified by physical therapy or the medical establishment, it is quite easy for them to confuse the piriformis muscle with the SI joint as the point at which the pain is being elicited. But without any altered range of motion deficits of the SI joint, as with all joints, there's no reason to think that it would elicit pain. Okay? But if it was the piriformis muscle, well, the piriformis muscle is only going to strain as a result of a gluteus medius strain. So the gluteus medius is responsible for stability and the ability to maintain balance. So you're going to have a deficit. You're going to notice you kind of probably have a pelvis where one side is higher than the other. You're going to find more difficulty walking or standing on one side or the other. Those are all indications of gluteus medius breaking down, which would lead the piriformis to strain. The hamstring, on the other hand, would strain basically as a result of some sort of imbalance, typically between the quads and the hamstrings, or maybe the hamstring strained. It is possible that the gluteus medius muscle strained and it's causing the hamstring to account for the extra load that would be picked up by the gluteus medius. But all of these type determinations have to be done through a physical evaluation, looking at the body's presentation of symptoms, which is at the core of the Yass means of diagnosing the cause of your pain. These type of interpretations are not done through the medical system. All you get is an MRI or an X-ray. So If you really want to understand the cause of your pain, you're going to need that physical evaluation, which is at the core of the Yass method for diagnosing the cause of symptoms. If it is confirmed to be muscular, then you have to understand how to do the proper exercise, which again is at the core of the Yass method for treating those symptoms when found to be muscular. So there's your discussion on what the two primary causes of gluteal region pain are: piriformis strain, hamstring strain. And now you understand how to identify it and what you would need to do to treat it. All right? If you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are being added or when I'm live on YouTube. If you want to contact me, if you have any questions or you'd like to set up a Zoom or Skype session because now things are starting to make sense to you and you'd like me to assist you in getting the proper diagnosis and treatment, you could do so by emailing me at drmitch@mitchellyass.com, drmitch at mitchellyass.com, drmitch@mitchellyass.com. Let's keep working together. Let's spread the gospel of the Yass method. Let people know there's an alternative to the existing medical establishment. You do not have to be a prisoner of this system. There is a better, more logical method for diagnosing and treating the cause of your pain, and that is the Yass method. Let's work together. Let's spread the gospel. Let's end chronic pain globally. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.